Hello my dear student, aspirant student. We are on pharmacology sessions and we are doing multiple choice questions. And if you have gone to some other sessions, you must have seen it was very interesting. And we are going to another interesting session. A session of 10 questions, 10 multiple choice questions. We're going to discuss the questions, try to understand a bit about the drugs. Question number 1. Which of the following would be the best agent to use in a patient with polycystic ovarian syndrome? PCOS, polycystic ovarian syndrome. Pioglitazone, metformin, regular insulin, repaglinide and chlorpropamide. So the exam has included chlorpropamide, repaglinide, insulin releasers, there's insulin, there's metformin, insulin sensitizer, and pioglitazone, the drug related to the gene regulation, PPAR. Which of the following is best to use in a patient with polycystic ovarian syndrome? You need to understand something. Polycystic ovarian syndrome, in this particular condition, you get insulin resistance. And that's one of the important causes of the further complications. And if you could decrease the insulin resistance and if the tissues start responding, then there is a chance of ovulation. And then she can get pregnancy. So that's very important. Are you thinking of anything which will decrease the insulin resistance, which will increase the sensitivity of the insulin receptors to insulin? So I'm asking you about insulin sensitizers. So which is the group we call insulin sensitizer? Obviously there's only one, and that's bigonides. So that's metformin. Have a look at the answer. Metformin decreases insulin resistance, and this could be helpful so that there'll be ovulation and there'll be pregnancy. So please remember, these are all the anti-diabetic agents, and the question is not related to diabetes, but it's important. Metformin can be used in polycystic ovarian syndrome. Question number 2. Which of the following can be delivered to the systemic circulation by the route of induction? What is this? Induction. Okay, let's have a look at the option. Salbutamol, digoxin, nitroglycerin, oral contraceptives, and salmeterol. And if you don't know this induction, I have to tell you, induction is the local application of a drug in the form of an ointment. And in the past, this particular term was used when the ointments were rubbed into the skin. So now you rub it or don't rub it, when you use an ointment and it's going to travel across the transdermal route of administration and is going to enter systemic circulation, it will be called as induction. Now you will solve it. Salbutamol, digoxin, nitroglycerin, oral contraceptives, and salmeterol. What is it? Yes, nitroglycerin. Nitroglycerin is available as ointment by transdermal route of administration. Okay, that was question number 2. Next question, question number 3. Oral iron absorption is enhanced by tetracyclines, antacids, phytates, vitamin C, and milk. Once again, tetracyclines, antacids, phytates, vitamin C, and milk. Obviously, what is it? Iron has to get reduced. You know, it's in ferrous form and has to get reduced to the ferric form. And who is going to do it? Reducing agents are going to do it. And one of the most important reducing agents are always weak acids. Which one is it? The weak acid from this. Vitamin C, yes, that's ascorbic acid. And if you look at the rest of the drugs, tetracyclines, no, they decrease the oral iron absorption. Antacids obviously decrease the absorption. Phytates decrease the absorption. And milk, which has positive ions, is going to decrease the absorption. So absorption is increased by acids and reducing substances, always please remember, and is decreased by milk, tetracycline, phytates, phosphates, and antacids. So this was question number 3. Next, question number 4. Following are the side effects of estrogens, except. The way to solve these except type of questions is to read the statement full, including the option. So you get a full statement. So the stem, remove the term except and read the statement before except and join the option with it. For example, I'll show you. Following are the side effects of estrogen, gallstones. Do you feel it's there? Yes, gallstones. Following are the side effects of estrogen, early fusion of hypophysis. Does it happen if you give large doses of estrogen in the growing age? Yes, because they are going to stimulate the early fusion and the epiphysis will close. Following are the side effects of estrogen, hot flushes, As soon as you say estrogens, you feel hot flushes. But the question is it a side effect? Does it produce hot flushes? When are the hot flushes present? So that's a symptom of menopause. When the estrogens are going down, what does it mean? It means the absence of estrogen is responsible for hot flushes, not estrogens produce hot flushes. Okay? And the exam is asking us except. So this is the likely answer. Let's wait. Have patience. Go to the next one. Thromboembolic events. Do they produce thromboembolism? Yes. That's a predominant adverse effect of the oral contraceptives. Last one is nausea and migraine. That's the most common adverse effect of estrogens and the oral contraceptives. So most probably we should be right if we choose hot flushes. Let's go to this. Yes, hot flushes. And I have written down a sentence below so that you will always remember it. They relieve hot flushes. Please remember, estrogens relieve hot flushes. That's why the estrogens are given as hormone replacement therapy. I hope you know this. You can call it hot flushes, you can call it hot flashes, depending on what type of English you are using. So that's question number 4. Question number 5. Which of the following is preferred in obese diabetics? If the diabetic is obese, which of the following is preferred? Glibenclamide, chlorpropamide, pioglitazone, metformin, and repaglinide. For your kind information, the first group of oral antidiabetics, that's sulfonylureas and meglitinides, they are insulin releasers, and most predominant adverse effect of them is weight gain. So you cannot use it for obese diabetics. One more group which is modifying the gene regulation, that's PPAR, is glitazones, that's pioglitazone, rosiglitazone group. This also produces predominant weight gain. We are left with only one group, and that one group is the pioguanides, which are insulin sensitizers. And these drugs produce profound anorexia, and then the intake of food will be less, and this leads to weight loss. So if your type 2 diabetic is obese, then the preferred drug will be a biguanide. Do you have a biguanide on this list? Yes, it's metformin. Glibenclamide, sulfonylurea. Chlorpropamide, generation 1 sulfonylurea. Pioglitazone, a glitazone, PPAR analog. Metformin is the biguanide, and repaglinide, the last one, is again a meglitinide. So the answer will be metformin. Please remember, type 2 diabetic who is obese, always go for biguanides, because all others produce weight gain, and only metformin out of these 5 reduces anorexia and weight loss. We're moving to the next question, that's question number 6. Which of the following causes constipation? A straightforward, direct question. You need to know the important adverse effects from each classes of drugs. Propranolol, nitroglycerin, captopril, verapamil, and spironolactone. Once again, propranolol, nitroglycerin, captopril, verapamil, and spironolactone. Does anything strike to you? A very predominant adverse effect of a drug is constipation, and you need to know this. Many drugs can produce constipation that way, but which one is most likely? And it's a calcium channel blocker, verapamil. That's the most predominant adverse effect of verapamil. Please try to memorize this. We go to the next question, question number 7. Which of the following is preferred for differentiating between myasthenic crisis and cholinergic crisis? So we are discussing about myasthenia gravis, and we want to give a drug to the patient when the patient is coming with muscle weakness, and this drug should be able to differentiate between myasthenic crisis and cholinergic crisis. What is usually done is the drug which is used for myasthenia gravis, the same kind of drug is given to the patient. And if you give the same kind of the drug, if the patient is suffering from myasthenic crisis, because this drug is an anticholinesterase agent, is going to improve the patient. And if the patient is suffering from cholinergic crisis, means already there's more acetylcholine in the skeletal muscle, your drug is going to add to that acetylcholine and is going to weaken the muscle, is going to worsen the condition. So this is how you use it. So most probably we use a drug which is going to pour acetylcholine, and that should be an anticholinesterase drug. That's very clear. So if you look at the names, idrophonium, is it an anticholinesterase agent? Yes. Neostigmine, anticholinesterase? Yes. Atropine, anticholinergic. Leave it out. it's anticholinergic. It's not anticholinesterase. And it acts on the muscarinic receptors. We're speaking about nicotinic receptor, that's skeletal muscle. But more important than that, it's anticholinergic, so we don't want this. D-tuberculin blocks the muscarinic receptor. So blocks the nicotinic receptor. So nicotinic receptor in the skeletal muscle. So leave it out for some time. Rivastigmine, yes, anticholinesterase. So our top choices will be idrophonium, neostigmine, and rivastigmine. If you remember, rivastigmine is a drug which has got good penetration across the blood-brain barrier, and that's used in the symptomatic management of Alzheimer's disease. So let's keep rivastigmine also aside. Now we have two left, idrophonium and neostigmine. Please remember, we are doing this just for diagnosis, just for differentiating between myasthenic and cholinergic crisis. And it would be worthwhile if we use a drug which acts for short time. You don't want to produce harmful effect in the patient. So we would like to use something which is going to act only for short time. And for this short period of time, we should choose a drug which is short acting, which produces immediate effect. So onset of action will be fast and the effect will be over very fast. So which one is fast acting? Which one is short acting? Idrophonium or neostigmine? Obviously it's idrophonium. It's the shortest acting anticholinesterase agent. So always go for this to differentiate between myasthenic crisis and cholinergic crisis. I'll take you to the answer. Yes, idrophonium. Let me remind you, there is another test for diagnosis of myasthenia to differentiate between myasthenic and the cholinergic crisis. And D-tuberculin, which has got opposite effect, it blocks the nicotinic receptor, could also be used. It's called provocative test, but idrophonium test is better, and this is a preferred agent. So your stem of the question also contains the word which of the following is preferred. So we are going for the best possibility, and that's idrophonium. Let's go to the next question. That's question number 8. Which of the following is cardiotoxic? Cardiotoxic. And examples are adriamycin, bleomycin, cyclophosphamide, methotrexate, and mercaptopurine. What are all these? These are all anti-cancer drugs. And which one is cardiotoxic? Question is something different. When we think of the anti-cancer drugs, you always talk about bone marrow suppression, you talk about alopecia, you talk about vomiting, sometimes about nephrotoxicity, neurotoxicity, and so many other general toxicity of the anti-cancer drugs. This is something specific, cardiotoxicity. And do you remember any drug which is cardiotoxic? Adriamycin, bleomycin, cyclophosphamide, methotrexate, and mercaptopurine. If you remember it, there's only one drug on this list which is cardiotoxic, and that's called adriamycin. Adriamycin is one name, another name is doxorubicin. So doxorubicin is cardiotoxic, and it produces delayed cardiomyopathy and delayed heart failure. So that's question number 8. Remember this, adriamycin. Adriamycin is the answer. Go to the next question, question number 9. The onset of action of warfarin sodium is 15 minutes, 1 hour, 4 hours, 1 to 3 days, 3 to 5 days. Warfarin sodium is an anticoagulant. First of all, decide it's an oral or parenteral. It's an oral anticoagulant. Yes. What's another anticoagulant which is used commonly, parenterally? That's heparin. Go by common sense. Heparin is a parenteral anticoagulant, warfarin is oral anticoagulant. Which one is going to act fast? Obviously the parenteral, that's heparin. Immediately starts its effect. Warfarin sodium is given orally, the effect is going to be slow. But not just because it's given orally, there's a difference in the mechanism of action. Heparin acts with the antithrombin mechanism, and warfarin sodium inhibits the vitamin K. It is going to inhibit the synthesis of vitamin K dependent clotting factors. So please think, when warfarin sodium will start acting, it has to start inhibiting the activation of vitamin K. Then the synthesis of clotting factors is going to be inhibited, is going to take some time. So also some clotting factors are already present in the blood. They are already having the action. So unless the action of those clotting factors is over, you cannot visualize the action of warfarin. Naturally there will be a time lag. So please remember, heparin action is fast. Warfarin sodium has got a time lag, and the time lag depends on the half-life of the clotting factors which are already present, and that half-life is quite long. The shortest is 8 hours and the longest is up to 60 hours. So at least within 1 day you cannot expect the effect to appear. You will have to wait for more than 1 day, and we have to choose the right option from this. 15 minutes, 1 hour and 4 hours is obviously out. There's 1 to 3 days and 3 to 5 days. Let's not go to the extreme. At least 1 day. So 1 to 3 days. Let's check our answer. Yeah, it's 1 to 3 days. Please do your anticoagulants well. They are useful for your practice, and these are some very important issues about which you always get questions on your various postgraduate entrance examinations and your examinations of various countries, where you have to pass an examination to enter the country and start your practice and to get your registration. So we go to the last question on this session. That's question number 10. All of the following are acid resistant except. All of the following are acid resistant. Acid resistant means they can withstand the effect of the acid. Which acid we are talking about? Is gastric hydrochloric acid. It means which of the following can be given by oral route and they will not be destroyed by gastric hydrochloric acid, so that you can give them in the form of tablets, capsules, etc. Are you getting it? Yes. Methicillin, penicillin V, cloxacillin, amoxicillin and clavulanic acid. So you ask yourself a question, go by common sense. Everything is not in the book and many of the things are in the life. So please remember, any of your friends ever took ampicillin, amoxicillin? And most probably the answer will be yes, amoxicillin. And it was taken by oral route or by injection? It's available by oral route, obviously. So amoxicillin is given by oral route. Penicillin V, the name itself was given because this drug is available by oral route. It was the first acid resistant penicillin. So penicillin V. We got at least 2 and it's going to be easy. The next 2 drugs, option C, cloxacillin, is a penicillinase resistant penicillin, and it's also available by oral route of administration. The last one, clavulanic acid, is a beta-lactamase inhibitor, and the other beta-lactamase inhibitor group is sulbactam, tazobactam, etc., which have to be injected. So clavulanic acid can be given by oral route of administration. So in this way we are left with option A, that's methicillin. That was the first penicillinase resistant penicillin. Now it's not on the market, it's not commonly used. The reason is methicillin proved to be nephrotoxic. The methicillin had severe toxicities, but please remember, once upon a time this was a gift to us and it was useful against resistant staphylococcal infections. So that's a penicillinase resistant penicillin. But methicillin cannot be given orally, it has to be injected. The question is, all of the following are acid resistant. I will convert the question. All of the following can be given orally except, and now it will be easy, that's methicillin. Let's have a look. Methicillin, right. I hope you enjoyed the session, and we'll keep on meeting on more sessions of pharmacology multiple choice questions, and everything will be fine. Good luck.